Hi, my name is Florence DiGennaro Reed. I'm really excited to be here and talk about a topic that I'm passionate about, staff training. I have been studying staff training or delivering staff training for about 20 years. I did so for about 14 years at the University of Kansas, where I was a professor and led a research lab that focused on performance management within the broader umbrella of organizational behavior management. I am now at the Behavior Analyst Certification Board, where I work as its Chief Operating Officer. It's important here to insert the necessary disclaimer that I am not speaking on behalf of the BACB or represent the BACB in this video. I want to talk to you first about the importance of staff training, both at the start of employment and in an ongoing way as part of professional development of an employee. It would be really inappropriate for a company or a supervisor to assume that a new employee had all the skills in their repertoire that they're going to need to have to be successful in their role. In some instances, employees have a lot of those skills, but in many, there are certain procedures and processes or approaches at their company where they would still need training. Or it could be that a large portion of their role, they do need training to accomplish successfully. It's also important to provide ongoing staff training and support for all employees at every level. You want employees to be challenged. You want employees to refine their skill sets so they can meet the changing needs of an organization. You want an employee to stay with a company and have a lengthy tenure. And by investing in them through ongoing training and support is one way to encourage that. Imagine a situation where a staff person, it could be a registered behavior technician or a behavior analyst, got hired by a behavioral healthcare organization to work with some of the most vulnerable people in our country. People diagnosed with some sort of disability or need of support in some capacity, and no training was provided to those employees. They may come with some sort of credential already, but that's a minimum competency, and there's a range of things that they could perform, but likely they don't have all the skills they would need to provide high quality, effective services for all of the individuals receiving services at that company. So if they didn't get training, that would really impact the quality of services provided to people who really need high quality services. It would result in a waste of precious resources, likely produce burnout and high levels of turnover, and potentially disrupt or damage the reputation of the company. There is research to show that in those environments, training could benefit from improvement, both in terms of the quality, the types of procedures used, and how often it's provided. So I'm thrilled that this module is being offered. I want to talk next about the 4 components of an evidence-based training approach called behavioral skills training. You might also hear the term performance and competency-based training. Both of these approaches essentially refer to the same procedures, though they talk about them a little bit differently. I'll emphasize behavioral skills training, or BST, in this video. So BST includes 4 components: instructions, modeling or demonstration, practice, that could be in the form of role play or practice in an actual work environment, and feedback. So instructions, modeling, practice, and feedback. Those are the 4 components. How those components are adopted within any particular training program can vary widely. So instruction could be provided in the form of a lecture or me describing the target skill you're expected to perform. It could also be provided in a PowerPoint slide or in some other written format, like a protocol that you can read on a piece of paper. There's something called enhanced written instructions that includes written instructions that are formatted simply, without any jargon, with diagrams or pictures as appropriate. That has been shown to be effective to train some skills. More research is needed because it's been a limited subset of skills. So you can combine one or more of these instructional practices if you're going to adopt behavioral skills training. Next is modeling or demonstration, and that is where a trainer performs the target skill and the trainee is expected to observe and watch the person perform that skill. It's often done live in a face-to-face format. It could also be recorded and presented in a video model. With the use of technology like Zoom or Microsoft Teams, some modeling is done virtually. And so there are lots of different ways you could arrange modeling as well. Practice could be done in an artificial sort of simulated environment. It's often done in like a conference room at a company where training is taking place. It could also be done over technology as well. We saw that quite a bit during the pandemic where we had to arrange training opportunities virtually. And so you kind of did the best you could in a simulation. It could also be done in the real work environment in whatever setup that you have. So if it is a service setting, it could be done with actual clients or students or patients and arranged that way. Again, just like instructions and modeling, the practice component could vary as well. And then there's feedback. Feedback can vary widely. So you could provide vocal feedback, written feedback, that could be done over email, a note in a mailbox, text message. You could emphasize skills that the person performed correctly, areas that need improvement, and so corrective feedback. You could change the various qualities of feedback. So it could be based on the person's performance. It could be based against a standard, against group performance. You could change the sequence of feedback. So you could present corrective feedback first, follow it by positive feedback, or swap it in some capacity. So there's lots of different ways to give feedback. It could be done immediately, delayed. So you could, again, configure feedback in various ways to help promote learning of a skill. So I hope it's clear that these 4 components could be adopted in lots of different ways, and they all could still be considered behavioral skills training. That could make it fun to be creative if you're developing a training program. It can also make it difficult for you to know as a trainer which variations would work best to teach a particular skill. And that's where going to the literature is really helpful. So we've seen there's been some research that shows the enhanced written instructions piece could be really effective for teaching preference assessment, but maybe not for other skills, right? So if you go to the literature to see what training practices have been used to teach various skills, you could create an evidence-based training program by adopting the different variations of BST in a way that promotes success. The other thing I like to think about when arranging a training program, you're often not training a single skill. And so if you have a set period of time, let's say it's 5 days to teach a cadre of skills to a new staff person, you're going to want to develop a training program that is robust, interesting, keeps the new employee engaged meaningfully, and is successful, produces desired outcomes. So I like to think about it as arranging a variety of experiences for the trainee so that they develop the necessary skills, but it's interesting for them and you don't see heads nodding in the training experience. So it could be a little bit of lecture, some video model, maybe some practice with feedback, a shadow experience, and then they'll be moving in and out of these experiences as you move from skill to skill. I want to wrap up by talking a little bit about a training approach that we introduced at a behavioral healthcare organization in Kansas. We were teaching supervisors and individuals who are interested in learning how to be effective trainers, how to use behavioral skills training in group homes all across the state. And these were folks who were peer trainers to new staff coming to work in the group homes. So we taught them how to use behavioral skills training. When we started off, we wanted to evaluate the effectiveness of this program because we were creating this systems change for the company and we wanted to make sure that it worked. So our efforts initially involved arranging workshops that lasted a couple of hours with groups of staff who would come in. Myself and a graduate student would do a lecture and we built in the modeling, live modeling within that. We asked trainees to practice with each other, give each other feedback. So we tried to adopt in this creative way behavioral skills training that allowed us to reach groups of people all at one time. In a research study that we published in the Journal of Applied Behavior Analysis, we showed that 80% of trainees, 20 out of 25, were able to effectively use behavioral skills training in our role plays and in maintenance probes with either the instructions, modeling from us and practice and feedback with each other, or layering on a little bit of feedback from us. So that was really effective. We then wanted to make it a little bit more efficient because it was tough having to do this multiple times a month, or at least once a month. So we created a video model where we put all of the instructions and the models to a video, and we didn't arrange practice and feedback with partners, with trainees partnered up. And what we showed is that some of the participants could improve their behavioral skills training implementation just with watching the video model, but that some people still needed some feedback when they demonstrated for us. So that paper was also published in the Journal of Applied Behavior Analysis, and we were really proud of what we had accomplished. We then sought to evaluate whether trainers were actually using these skills in the group homes where they worked. And unfortunately, they were not. So we needed to provide more ongoing support, and we did coaching observations. We would come in and we would observe and then give real-time feedback and support to new trainers as they were doing real-life training with new staff, which they absolutely loved. We layered on an incentive for them to earn money that they could exchange for some sort of gift on a gift-giving platform. We also changed our training approach with the pandemic because it was difficult for us to do live training. So we started doing training over Zoom, where all of it now, we did the video modeling, the practice and feedback all over Zoom, and then still did the observations in the group home. And that was also really effective. So I hope that's a reasonable demonstration to show how you can adopt behavioral skills training in several different ways, as long as those 4 components are included, to meet the needs of the trainees that you're trying to support, or the employees that you're trying to support in an ongoing way. Thank you so much, and best of luck as you level up your staff training procedures.